Welcome to Health Facts with Normanie Ricks. I am your host, Normanie Ricks. I like to start each episode off with a little known health fact. Did you know that the pharmaceutical industry each year makes $300 billion? I did not know that. That is a very eye-opening fact. Also, I found out that Benjamin Franklin was a pharmacist and Agatha Christie was a pharmacy technician. I feel like the United States has a deep-rooted history in the pharmaceutical industry. Well, today's guest is Dr. Esther Onyoni. She's a clinical pharmacist of over 15 years. She's also a health and wellness coach. She's very passionate about the areas of diabetes and insulin. I would like to welcome Dr. Esther Onyoni onto the program. Thank you so much, Dr. Esther. How are you doing?
I'm doing good. Thank you for inviting me over here on your program, and thanks for having me.
All right. So let's first start off talking about the Wellness Pathfinders. You're the owner and operator of Wellness Pathfinders. What is that?
Sure. I love that name. It's just, to me, it makes you feel like you have hope that there is a path to being well. I started the company because I became certified as a health coach, a diabetes health coach. I was interested in diabetes, considering my practice as a pharmacist. I have been in practice for about 15 years. And after being in practice for that long, you've made observations, of course. Some observations being you see the same patients coming in every month or several times a month. And for whatever condition they are being treated for, when you see their medication, you'll know what they're being treated for. And you get to a point where you wonder, does this get better? Are they going to get better? And sometimes you see their condition deteriorate, or you could see them starting to take more and more medications. And for me, that's where it started bothering me, to be frank. I saw individuals come in, they start with the medication and then maybe something else to take care of whatever side effect has come up, or in the case of diabetes, where I decided to specialize in, someone would actually get a diagnosis, come in with a prescription, but then there's also other things going on in their life. Maybe their condition is not well controlled. Then they are not, so maybe their blood sugars are up. They use the bathroom often at night. They're not sleeping, but they go to the provider, and the provider says, "Oh, here's something for sleep," and there you have another thing to take. So that's polypharmacy, more medications each time you see your provider. And every time I came in contact with these individuals, all I could think in my head is, can we just hit the reset button? Because you just don't need all of these things. And so one way I could get past that, I noticed, is to get myself certified as a health coach, because I provide more value for them. That way they don't feel the hopelessness of just taking medication and that's kind of it for them. It doesn't have to feel that way.
So, Dr. Onyoni, you touched on feeling hopeless and helpless. I think it sounds like to me that was what drove you to be passionate in this area. So can you speak to some specific examples where someone came to you and they were just at their wits' end?
Oh, definitely. Several, actually. Where someone calls me on the phone and says, yes, I started taking my medicine for diabetes, but they just got up in the morning and their numbers are high. Their blood sugar, they just check it, it's very high. And they don't know what to eat. So are they just going to eat lettuce and that's it? Because if they eat anything else, it's just going to shoot up much higher. And you could see the hopelessness of, they don't know what to do. There is overwhelm there. They don't know what to do. They don't know what to eat. You wonder whether they had that interaction with their provider. Then there's also situations where individuals would come in and they say, this medication, I've taken it before, makes me feel very, very sick, but it's the only thing my provider gives me. And you wonder, of course, there are guidelines that we are trained to practice from, but you also need to individualize this. So there's no individualization there where someone feels, okay, it makes me sick, but this is all I have to take. That you feel the hopelessness there where they're not being heard. And you could come through for them by saying, okay, what else can you do at home besides the medication? Because, or not only that, and how else can you advocate for myself, which is mostly my mission with my practice, to empower people to advocate for themselves, help them prepare for doctor's visits or prepare for travel, prepare just to be heard. You know, they have a script, they have a way to talk about their condition. That way they understand what's going on, and maybe they are more empowered to really take more charge for themselves.
So do you ever feel as a pharmacist that you're kind of stepping on the doctor's toes? Yeah, speak on that.
Not really. No, I mean, okay. As a health coach,
Mm-hmm.
no. As a pharmacist, you sometimes you feel that way, but remember, we're not licensed to practice as a doctor, so we can't really tell somebody don't take that medication, even if it's giving you side effects. What we will do is just refer you back to your provider. So you can suggest for them to go back to their provider and educate them for the most part that this is prone to happen to them, but then there are options for them. So you do walk that path of not needing to step on the provider's toes, but then also I do give suggestions to the providers that this is giving side effects, there are options, and some providers will change the prescription and some will decide that this is what they need to do.
Okay. So let's talk about the side effects, because some medications cause side effects and then doctors prescribe more medication that causes more side effects, that prescribes more medication that makes more side effects. So it's just a slippery slope. So what is your opinion on that?
Yeah, which is why I feel like, okay, let's hit the reset button. In the pharmacy world, there is such a thing as medication therapy management, which is where you would actually sit with the pharmacist and go over all your medications and all your vitamins to see whether you need to be taking some of this or not. I'm actually not completely a fan of that, because all it's doing, sometimes you'll find yourself combining some medications. So you're really reducing the pill burden by keeping it there, but maybe combining the medications, because some of them come 2 tablets in one, 2 different medications in one. I like the idea of, okay, let's use the medication as a bridge to you being well, because that way you don't have the mentality where you think that as long as you're taking medication, your diabetes is under control. It's medication and lifestyle changes, then it's actually under control. Because remember, when you learn what you need to do and you change that in your lifestyle, what happens? The doctor actually takes you off some of those medications.
So how do you coach people in your wellness business on like what to eat? What doesn't spike your blood pressure, your glucose levels?
I like that. Having trained as a pharmacist, we train to manage the condition with medication. And then having trained as a wellness coach, it opened my mind. It's more, okay, there is a bigger world here than medication. And yes, nutrition is a piece to the puzzle. It's actually the whole human being. Yes, what I do is I'll approach, somebody approaches me, we'll go with, what are you eating? You know, a lot of people know what they need to eat. They know the right
Do they
things to
though?
eat.
I think a lot of people don't know what to eat. Let's give them some examples of what a good day of eating is.
Okay, so the reason I say that is they'll say, okay, I know I could spend less time at the drive-thru and more time cooking at home. Yes, on a daily basis, eating foods that have more fiber, but what are they? So it's pretty much your vegetables. What do you do? Some people say, yeah, I don't like my vegetables, but in this day and era of Pinterest, you could find a way to spice it up. Throw in some salted, yeah, that's what they tell me. At least my client told me, okay, I went on Pinterest and found a recipe that worked for me, which I love that. I like to make it simple, even when you work with this, or at least when you hear these popular physicians talk about lifestyle changes, like Mike Herman, all he says is keep it simple, saute some onions, throw in some veggies. So, if it's broccoli, whatever your favorite veggies are, and some garlic, and you're ready to eat.
So what about garlic? So does garlic help?
Well, you're using that to like flavoring here. It's going to help, but I don't think you want to just put all your hopes on garlic. You're putting it all together. As an adaptogen, it's an adaptogen. It's a spice,
Okay.
So to flavor it helps you enjoy the food, I would say, at least for me and a lot of people I've talked to. And so just talking about how you can incorporate that in all your meals, people find it interesting that you say, okay, you can get your mixed veggies or your string beans or broccoli, which is my favorite, depending on the way I saute it, and put that on your plate for breakfast. And people say, what do you mean? You can eat those things for breakfast? And that's how you add vegetables to your breakfast. And that way it prevents you from having too much of the pastries for breakfast or dessert for breakfast. Mm-hmm. So by the time you add your veggies, by the time you add your whole grain products, or by the time you add your protein there, whatever you eat, egg or meat, or, you have reduced how much processed food you're adding to your breakfast or your meals, really. And that's where we start. So that's why I say sometimes, yes, people know what to eat, but this is where you add on value for them.
Okay. I have a question. What about like sugar-free candy, sugar-free snacks, bars, like the quick snacks that are labeled as sugar-free? Are those good for people?
And that's not always good for people. I say that because they have the sweeteners, artificial sweeteners, which are chemicals. The thing is, they're easy pick-me-ups, and we live in a world that's really fast. You need to be at work, you need to be somewhere. Mm-hmm. So they're easy pick-me-ups, but it helps if you're able to plan in advance, so you're not just depending on those. I would say the artificial sweeteners, people who actually drink like diet soda, which is got the artificial sweeteners, or even just eating a lot of those products, they still gain weight because your body still triggers production of insulin, and it doesn't really help. So if you find a way to just avoid those, one of my favorite ways to avoid that is to celebrate when you walk out of the grocery store without them. Yeah, so they're not the best, actually, and we go around that by trying to plan ahead.
Okay. So I want to ask you about the cultural differences, because I know you grew up in Kenya, correct?
I did.
All right. And so what are the cultural differences between, let's say, Africa and the United States as far as like eating at the table or like picking up fast food or things like that. Just kind of talk about the cultural differences and what we can do in the United States to not be such a insulin dependent society.
I love that.
Mm-hmm.
So, yes, I grew up in Kenya, but I think I've been here longer than I lived in Kenya. So
you remember though?
Yeah, I do, of course. I came here, I was already grown, so I remember. The differences I see, of course, we have in Kenya, and most countries in Africa, I think what I've seen is they have staple food. You know, you're more like your staples in your pantry. We have staple foods, which are things you eat daily, pretty much. In Kenya, it's more cornmeal. So corn, it's you got flour and you cook it in water and until it's the consistency of cake, and you eat that with veggies. So each meal has veggies, maybe meat. Some people couldn't afford all the protein, and they just have the veggies. So it was, I think, and I want to say it was when I was there, because now it's more industrialized, I would say, and people want to live the American dream, and they have more processed food coming in now. So
okay,
it's getting to the level where we're also going to worry about diabetes in Kenya. But back as I grew up, it was more you eat the staple food. So you always had your veggies with that were not processed, because breakfast you literally have a green banana or sweet potato. Those are healthy. And we never had bread, not that it doesn't exist, but a lot of households couldn't afford it,
Okay.
And now it's more, oh yeah, it's available. And then your lunch had a lot of lentils or beans. Mm-hmm. So it's more of a balanced diet, less processed food. Mm-hmm. And that's what I grew up. I was used to that. A lot of squash. Mm-hmm. I haven't changed how I eat here. I actually go looking for the squash all the time. And we never had drive-thrus. That's different. It's still the same. I don't see a lot of drive-thrus there when I visit, but I would say that they have a lot of fast food restaurants now.
Now, okay. So yes. I've traveled to a lot of different countries. I visited Africa. I went to Zambia. I lived in Japan before. I visited Korea, a lot of countries in Central America. And one thing that I noticed, they usually have what they call their staple foods. And a lot of times they eat like the same things almost every day. Whereas in the United States, we find that boring. So we're always seeking the next thing, and like everything that's sugary, sweet, anything that's colorful or more fun. It's just always more. So I think that maybe like when you're working with people for like meal planning in your coaching business, maybe tell them try to eat the same things every day. Maybe that will help them with their diet.
You bring up a beautiful point. And I have done that. We live in the South. Mm-hmm. I think a couple of my clients were very resistant, but I had to calm them down into that. Like, but you eat squash. How do you cook your squash? We bake it. All right, it's the same thing. So how else? What else can you garnish it with? What else can you add to it? So that it's simpler. You're not waiting to go to the drive-thru every day or whatever place that says they sell healthy food. You already have it. Just add something different to it, a different protein here and there. So I think by the end of the program, she said, "Oh, I did try it, and I could do it." So yes, I bring it up, and it takes on slowly because it's such a new concept. I agree. There's so much variety here that nobody wants to stick with one meal every day.
Exactly.
Yeah.
Okay. So I read on your website, you had 7 ways to eliminate toxins in diabetes. I was shocked to know that toxins can lead to diabetes. Can you talk about that?
Yes. So that's one of the things we touch on when we work together. there is nutrition, your regular lifestyle changes that are really hard to implement on your own. Once you would tackle your nutrition, how are you sleeping? How are you handling your stress? How are you able to implement movement? Then we talk about toxins, because they're all around us. And that's kind of one of those things that helps you get to the root cause of your diabetes, because your body is really meant to work as it should, but when you're sick, it's disease. It's not at ease. Something has triggered it to get sick. And one of the things could be toxins. So what if you have implemented all these things? You're not stressed, or at least you know how to manage it. You're eating well, your physical activity, all of that. Then we look further. Okay, toxins. So yes, they call it BPA product that's used in plastic, which plastic is all around us. I think when we buy products that have plastic, they say BPA free, but that's one of those things that once it's in your body, it can affect your pancreas. And there you go. The pancreas produces insulin, affects your diabetes, maybe it triggers diabetes, because you see, even if you have a family history of diabetes, it doesn't have to be the thing that you have, because you can avoid triggering it in your own body. And what if you were able to stop that triggering by avoiding toxins? There are toxins in our water, heavy metals. So, yearly, maybe each city will send a report of the toxins or the metals that are in the water. They'll tell you it's within level. That tells you that you need to watch out, maybe filter it, because if it's that the mercury, the lead, the arsenic, those are the heavy metals. They do affect, once absorbed into your body, they are taken up, and they can affect your pancreas. They can affect maybe the other essential minerals in your body that the body needs, like zinc. Maybe they displace those, and now you're not able to function because your body doesn't have zinc. And it's so subtle. You don't know what's going on. You just know that you're in pain. You just know that this is happening to your body, but it doesn't trigger you to think, okay, how am I living? There is all the chemicals around us as far as what we breathe, and what they're doing really is affecting important parts of our body. So the pancreas being one of those, and the liver, because the liver has to clear them. And when the liver does not know how to clear it, it helps create all those fatty cells that go and hide that toxin inside your fatty layer of your body. Could be whatever it hides it, you just start to gain weight, and you try to lose the weight, but it's actually holding on to the toxin, so that toxin doesn't harm you.
Mm-hmm. So one thing I noticed when traveling abroad is in the United States, we use plastics for everything, plastic, styrofoam, and all that stuff. And when I got home from some of my trips, I looked at like epidemiology reports, and it just seems like cancer and diabetes and heart disease affects the United States more because I just feel like we use a lot of plastics and styrofoams. And when you look at other countries might be affected by different diseases, but like it just seems like cancer runs rampant in the United States. Can you speak to some of that difference culturally?
Sure. I mean, because the US is industrialized, it's got all this technology, and in the other countries, it's not there because they don't have as much industry going on. That's one reason. Now, the other thing is, again, goes back to our bodies being there to protect us, and when something goes off, maybe you have a gene that is triggered, and that's why somebody ends up with diabetes. Maybe a gene is triggered and it does not trigger diabetes, but it actually triggers a cancer, so that it's now you're presenting with a cancer and not diabetes. So it's just the fact that we're industrialized and we just tend to have more chemicals in the air or toxins just being everywhere.
Yeah.
While the other countries, which are probably less industrialized, they don't tend to have that yet. But I also I'm observing that as the whole world loves to live the American dream, because that's how everybody describes it, they also run a risk of having that come their way.
Mm-hmm. So did you know about the $300 billion pharmaceutical industry? What pills do you think that you prescribe the most to people?
Oh my gosh. So I will say that the one thing that actually disappoints me is that just about every other medication I dispense is something for diabetes.
Oh, wow.
So, and it just makes me sad. And the older medications are still in use. So the most common one used is metformin, but I don't think that that's the most expensive. Actually, it's the cheapest. The newer medications, they are injectable medications that are advertised, that are used to help reduce the A1C, reduce weight, help reduce weight, all of that. I think they're very expensive, and they also are relabeled. So they're here for diabetes, but then they find the benefits of weight loss, so they label it with another name, and now it's used for weight loss. They are expensive. I think that individuals use them. At first, there's a lot of side effects. More of the gastric side effects, feeling nauseous, vomiting, just upset stomach. Those are common. Some people can handle it for a while and then it goes away, and some people can't and they have to get off of it. But the fact that they have to inject, I don't think they even stay on it for long, maybe a year, and then they are off of it. And the sad part about this is that once you're off of it, now maybe if you lost weight, the weight comes back. If you diabetes was under control, now it's no longer under control. Now you have to try something different, maybe a new medication, maybe a new lifestyle.
Okay. Well, Dr. Onyoni, can you leave us with a bit of advice and tell people how to get in touch with you? What's your website? What's your social media handles, and all of those things?
Oh, sure. Yes. What I've noticed is that once someone is diagnosed with diabetes, the one thing they can do is just get drastic with it. Okay? If they have been putting off something they need to do, there's never a good time to start. Just start and put in place whatever it is that you've been saying you want to do. Maybe you want to start a new movement routine, a new whatever it is, just start. You don't need to wait. And usually you cannot do this alone, because we know as humans, when you say, I'm going to do this, and you don't tell anybody, but you say it yourself, you never get to it. So it's good to say that to maybe somebody in your family, or if somebody who's going to help you stay accountable to that, so support you also. And if you don't have that, of course, get a coach, because the amount of time you spend at your provider's office is not enough to give you all those details and to help you stay accountable. So you definitely need a coach. And, as much as I practice as a pharmacist, I help people turn the situation around, because I've seen that this is possible. We don't have to see diabetes as a progressive and debilitating condition. It does not have to be.
All right.
And as I've learned, it's just taking time for yourself and doing all the simple things, which we do in my program. And so people can reach me. I'm on social media, on Facebook and on LinkedIn, under my name, Esther Onyoni. And maybe on my website, although you find me faster on social media, my website is thewellnesspathfinders.com. Hey, let's get on that path to being well.
All right, awesome. Well, we learned you do not have to do this alone, and all you need to do is start. Thank you.
Definitely.